There are so many questions when considering a cosmetic procedure. Am I the right candidate? How safe is it? What are my options? Luckily, St. Luke's has a team of experts qualified to help us. Today, we'll be learning about the plastic and reconstructive services offered at St. Luke's. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at plastics and reconstructive surgery offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Christopher Sanders, who serves as Chief of Reconstructive and Plastic Surgery for St. Luke's University Health Network. He specializes in all aspects of plastic surgery, including reconstruction and aesthetics, both surgical and non-surgical. His particular areas of interest are microsurgical breast reconstruction and body contouring after massive weight loss. He has dedicated a large part of his clinical research in these areas to improve the outcomes of his patients. Dr. Sanders, thanks for being here.
Great to be here. Thanks for having me.
Tell me a little bit about why you chose to become a plastic surgeon and what kind of training is involved.
Growing up, knew I wanted to be in the medical field and knew I wanted to be a surgeon, but one of the things I thought I didn't want to do was plastic surgery. And that's mostly because I didn't really have a good grasp of what the field is. More different areas of the body that plastic surgery operates on, all the different types of procedures, and it's not just kind of the Hollywood version of plastic surgery that a lot of us are used to. It has much more greater scope and depth than that. In terms of the training of plastic surgery, what that entails is essentially 4 years of medical school. And there's really two kind of tracks into how to become a plastic surgeon. One is where you would do 5 additional years of training in some surgical field after medical school, and then match into a plastic surgery training program, which is additionally another 3 years of training. It's a pretty long road when it's all said and done, but well worth it.
Thank you so much, and there's so much going on in the field. We're looking forward to learning more. Joining our panel next is a native of the Lehigh Valley, Dr. Allison Moline. Her goal is to empower individuals by achieving the best version of themselves. She sees plastic surgery as not just an isolated cosmetic or reconstructive procedure, but a cultivated and trusted relationship. She works with her patients to develop individualized plans to help them achieve their personal goals, health, and well-being, as well as restore their self-confidence. Dr. Moline, thank you for being here.
Thank you for having me.
How about you? It's such a transformative field. Why did you get interested in plastics, and what do you find most rewarding about the field?
Plastic surgery, the majority of our patients are women. And I think it's so powerful to be able to support women to achieve their goals. Women have so many roles. We're daughters, we're mothers, we work inside and outside of the home, and sometimes we put ourselves last. And so whether it be a situation that you're forced into, perhaps a breast reconstruction and you're having a mastectomy because of breast cancer, so an unanticipated surgery, or one that you're choosing to restore your body back to, its original state. It's incredible to be a part of that journey with women. And to be able to support women in that way and connect with them is just such an incredible part of plastic surgery and what drew me to the specialty.
Dr. Sanders had mentioned the idea that plastic surgery deals with really the whole body and so many complex and simple issues. What do you find most challenging about the field?
I think the thing that's the most challenging, but also the most rewarding is, and the most fascinating, and what keeps us on our toes as plastic surgeon, is that every person is different. This isn't a protocol. It's not a one-size-fits-all mentality when it comes to plastic surgery. It could be the same procedure, but we perform it differently depending on the needs of the patient and their goals.
Thank you both for sharing your expertise. We're looking forward to learning more. We'll be right back after a short break, but before we do that, let's check in with Dr. Jonathan Lamb out in the field as he gives us insight on the various cosmetic and reconstructive procedures available at St. Luke's.
Our specialty, plastic and reconstructive surgery, we deal with both aesthetics or cosmetics as well as reconstruction. I shadowed actually one of our surgeons here, Dr. Morrissey, when I was in college, and that kind of got me interested in the field of plastic surgery. I do my own art, and I've always leaned towards something in the surgical field, and I figured something that kind of merges both art and medicine together would be plastic surgery. Some of the most common plastic reconstructive surgeries that we do are breast reconstruction, reconstructions on the face for after Mohs surgery, so for skin cancers, as well as body contouring, so a lot of breast reductions, or what we call paniculectomies, where we remove a lot of excess skin for patients that have completed bariatric surgery and lost a lot of weight. Coaching a patient through a cosmetic decision, it's a very patient-oriented and patient-centric, so I ask them what are their goals. Then I kind of list out the options in terms of non-surgical things that we're able to do with lasers and toxins, and such as Botox and other injectables such as filler. And then we list kind of the surgical options. I kind of leave it up to them in terms of what changes in their appearance would they want to make them feel better. We treat a lot of breast cancer patients, and it's not just recreating the breast, but it also makes them feel their best to make it more natural. So a lot of what we do, although everyone thinks plastic surgery is just skin deep, but it affects their mentality and their mental health, and that you can't really quantify. So microsurgical breast reconstruction is basically a type of autologous breast reconstruction where we're using the patient's own tissue to recreate the breast. We take most commonly the abdominal tissue that a lot of people will call the tummy tuck tissue, and we actually, under the microscope, we find where those blood vessels are, we disconnect them, and then find those vessels up in the chest area. That's how we use their tissue in recreating their own breast so that we don't have to use foreign objects like implants. Over here at St. Luke's, we work hand in hand with our fellow colleagues from all different specialties. I think plastic surgery is one of the few specialties that we work with literally every other specialty. So particularly, we work hand in hand with our bariatric colleagues. When we see our patients, we see them on one step of the continuum that they're on. They have to get bariatric surgery, they lose a lot of weight, and then afterwards, they're usually stuck with a lot of excess skin, which can cause functional as well as aesthetic issues. We remove that excess skin, and at the same time, we try to contour the body to give it the best look possible. What's great about St. Luke's is just access to care, and we have, all our practitioners that work in our plastic surgery office are great. We have other colleagues from other specialties, other departments, and ultimately, we all get together at the end of the day to figure out a plan that's best for the patient. When patients come in and they have a great result, whether it's cosmetic or reconstruction, that's what makes us do what we want to do.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
Welcome back to St. Luke's Health Now. Tonight we're discussing transformational procedures available at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting your personal questions that we'll answer later in the show. Joining me are Dr. Christopher Sanders and Dr. Allison Maylene, who are experts in plastic surgery. Let's dive deeper into plastics and reconstructive surgery offered at St. Luke's. Dr. Sanders, I'm going to start with you because we often use reconstruction and cosmetic as interchangeable words, but they're not necessarily the same thing. Can you explain the difference?
Yeah, so, plastic surgery, encompasses, as we talked about, a wide range of different surgeries and techniques. Kind of classic way to break it down is plastic surgery is aesthetic surgery and reconstructive surgery. But really, when you look, those two surgeries, the techniques are very interchangeable between the two. It's just why are we doing a certain set of procedures? And kind of look at it as almost like a spectrum. We always say our goal at St. Luke's, even if a patient's getting what is, would be otherwise called a reconstructive surgery, we want to make it look like a more aesthetic type surgery. So we say, in plastic surgery, we're the specialty of form and function. And that's what we're really trying to restore for a patient, whether it is an aesthetic surgery versus a reconstructive surgery. When we look at sort of a breakdown, a patient may be getting breast reduction surgery, which is really a kind of surgery that is helping her symptoms, but we also want to make her achieve a look that she desires as well. That surgery is very similar to something like a breast lift, where it might be done more so to restore form and not necessarily to alleviate symptoms. But the surgeries are very similar in how they're performed. It's just that the goals of the individual patients might be a little bit different.
Dr. Maylene, I want to ask you about aesthetic surgery, and at what age do people consider this, and what are some of the most common procedures that patients will come to see you about?
The age is variable depending on what your goals are and what you're looking to achieve. But I think what's more important is doing it in the proper context of your life. So what that means is if you would like to have a breast procedure done, but it's imperative that you be able to breastfeed. Surgery on your breasts can affect your ability to breastfeed. So we have to have an honest conversation about that and determine if it's the right time for you to be doing a surgery. Or body contouring. I think it's imperative that we talk to our patients that if you're looking to have an abdominoplasty because you may not love the appearance of your abdomen after having children or after a massive weight loss, that you're not planning to have any more because it will just defeat the surgery that was just performed. So it's really putting it in the context of what's right for that patient at the right time and making sure that those outcomes are also sustainable. So right now we're seeing a lot of patients who are losing a lot of weight, whether it be through bariatric surgery or through some of the injectable medications or just through changes with diet and exercise, and making sure that they're at a stable weight. If they're at their lowest weight, but that's not actually sustainable for them, it's not the right time to do the procedure. So it's really developing that relationship and that trust, both from us and from the patients, that we're doing this at the right time for them and they believe in that process.
It makes a lot of sense to understand what else is going on in their world and their life and their plans to fit the surgery into that. Dr. Sanders, what about plastic surgery? What are some common procedures people come to see you about, and how do you guide them to the right procedure?
We see a lot of breast reconstruction for breast cancer patients. And I think that is a good illustration of some of the different options in terms of plastic surgery, because there are so many different options, and trying to figure out what the right option for the patient is the trick. The good news is for a lot of these procedures, there is no wrong answer. The right answer is the one that the patient and the surgeon are most comfortable with, and trying to figure that out in the consultation process, I think, is just as important determining the success of a surgery as opposed to in the operating room itself, because as we talked about, having that discussion about what the patient's goals are and what we can deliver from a surgical standpoint is very important.
When people are trying to make this decision, Dr. Moline, how do you guide them into kind of taking that leap? I mean, it's a big deal to say I'm going to get surgery, whether it is by choice or because of something like breast cancer. It's still a big leap to do that. So what's the process that you use to guide them?
Developing that trusted relationship with the patient and understanding what their goals are. There are a plethora of options when deciding what surgery is the proper surgery, just as Dr. Sanders just mentioned. And it's deciding which is the right one for that patient in that setting. And that can change over time as well. So something I think that's very important in breast reconstruction is that there are protections from the federal government, that being the Women's Health Care Act, that allow women to choose and change their reconstruction over their lifetime. And I think when we present things as physicians, it's our job to tell them that entire spectrum of what all of those options are, whether it be from complications or because the patient's body habitus changes or their goals change or their expectations change. But we want them to know that we'll be with them through that entire journey.
You mentioned there are lots of options. So Dr. Sanders, I want to ask you about some specifically. Microsurgical breast reconstruction. Can you tell us what that is and who's a good candidate?
We use the patient's own tissue, so it's a little bit different from implants, but microsurgical reconstruction is sort of a special subset of using the patient's own tissue, where we take the skin and the fat from the patient's body, and we use that and we dissect out the teeny tiny, literally microscopic blood vessels, and we take them out and we reattach it to the breast like a transplant, except it's a patient's own tissue. It's very specialized in the sense that it requires a lot of specialized equipment, specialized training. It's a little bit longer of a surgery, so it's a little bit more complex and involved. But most patients are actually very good candidates for it, unless they have extensive medical problems or maybe extensive abdominal surgeries in the past that, might not make them such a good candidate for using their own tissue from a particular place. But most patients are actually pretty good candidates for it.
One of the things people consider when they're going to have any kind of surgery is what kind of recovery time is involved. So Dr. Moline, can you walk us through, I know it's different procedure to procedure, but when someone's considering plastic surgery, what can they expect before, during, and after?
Both the preoperative planning and the postoperative expectations are absolutely imperative as a patient decides to do surgery. I think it's important from a preoperative standpoint to really be ready for surgery. I always say the stronger your foundation is going into surgery, the easier your recovery will be afterwards. So making sure patients are really ready going into surgery from a nutritional standpoint, from an exercise capacity standpoint, everything they can do to kind of prehab themselves to be ready for surgery. And then post-operatively, it takes months to recover. That's not actively meaning you have to be in bed recovering from surgery, but it's more so that it takes that amount of time for swelling to reduce, for scars to heal. I always tell patients 6 to 12 months until we make a decision of whether or not there may need to be little fixes here and there, which is very common with plastic surgery. But again, knowing that we'll be with you through it all.
Dr. Sanders, you said you've seen an uptick in body sculpting and body contouring. What does that entail, and who is a good candidate for that? Also, does it last?
Body contouring is a term that encompasses many different types of surgery, including breast contouring, abdominal contouring. When we're typically talking about body contouring, that usually means patients who have lost a significant amount of weight, particularly for things like bariatric surgery or some of the new medications that have been out. Usually those patients have significant issues in terms of loose hanging skin when you've lost 100 pounds, 150 pounds, 200 pounds. They have a lot of issues with things like rashing and infections that can significantly impact their daily lives. Really, a patient is at the best time to get it is when their weight has been stable, they're happy with their weight loss, they're as close to their target weight as they possibly can, because otherwise, if they're still in active weight loss and we do a surgery like that, we might do a surgery, they might look great and continue to lose weight and then wind up right back to where they started. So we want to make sure that the patient's stable from their overall weight loss standpoint.
Dr. Moline, is surgery always the best option, and are there other aesthetic procedures that could almost be a first step in your journey?
Surgery is a great way if there's extra skin, extra tissue. There are very few ways, if there's a significant amount of it, to remove it other than to cut it out. But there are things like smaller volume liposuction that can be done in the office to improve contour. There are even various devices, lasers and radio frequency devices that can be used to tighten tissue. But determining if you're a candidate for that, I do think takes a lot of skill to make sure that you reach your goals that you're looking for. If you have the expectation to have a minimally invasive procedure, but you have a significant excess of skin, I think it's important to hear from someone honestly that it may not be the best option. So I think that's something our group really pride ourselves on, is being 100% transparent and honest with patients to make sure that their expectations are met.
No, it's so very important, and I think what you said earlier about giving yourself plenty of time to heal is really important. It's amazing how many resources are available within our community. Speaking of, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
Here at St. Luke's Plastics and Reconstructive Surgery, we're so proud that we can offer some of the highest and most complicated services within plastic surgery. We do the whole gambit. We do the aesthetic things. We do the minimally invasive things, but we also do some of the most complex reconstructive procedures that are offered around the country. But what's really important is to know what all of your options are. Know that we're going to stand by you through your entire journey, through the ups and the downs, and we're going to get you through the other side.
Originally had breast cancer, was diagnosed with breast cancer in 2019. I opted for a mastectomy at the second recurrence. I have had, I think, 4 surgeries altogether. St. Luke's team really worked together to help me. One of the best things about St. Luke's is the variety of locations and the size of the network. It seems that there's always a location that's close by and convenient.
My approach when I'm talking to a patient about their treatment is to let them know that there's a spectrum of options for reconstruction. When Phoebe first came to see me, this wasn't her first rodeo with breast cancer. The treatment algorithm is different, and we really worked here at St. Luke's with our great multidisciplinary team, which is the most important part of it, but then also helping her feel beautiful and heal afterwards.
I was diagnosed with breast cancer last summer. I went for my first mammogram during the year that I turned 40, and they found that there was breast cancer. I wanted to make the best decision for myself and also for my family. So we met with several different oncologists and plastic surgeons, and we decided to go with the St. Luke's team when I met with the plastic surgeon, Dr. Moline. In talking to her, not only did she help me move through some of the processes of what happens after your breast cancer diagnosis and mastectomy surgery, she also told me that she would be with me through the entire process. She explained everything clearly, but still helped me feel like I was the one that was making the final decision on how things were going to go post-op.
I would recommend St. Luke's because they're positive. They return your calls if you have questions. They get right back to you. That says a lot about an organization, that it's a good place to be, and the people are positive and they help you. They helped me through a really tough time. They're always encouraging and they give you absolutely the best advice they have and the best treatment that they have.
Patients should choose St. Luke's for their plastic and reconstructive surgery needs because they are going to have a team that's unparalleled. There is a group of providers and medical assistants and office staff that are going to be here day and night to make sure you get what you need. We'll develop a personalized plan and make sure we see you through the finish line.
The people that are going to be handling your case or working with you are not only knowledgeable, but care about you as a patient.
Being able to help patients like Phoebe and Natasha is the reason that we do what we do. It's the most rewarding feeling. There's a lot of emotion behind it. We experience the ups and downs with patients when they have challenges that they're trying to overcome. We feel it too, but knowing that we're going to stick with them and get them there, there is no better feeling.
St. Luke's Pediatrics delivers everything from checkups to specialized care, all conveniently located close to home, so kids will have happy, healthy childhoods. St. Luke's Pediatrics, caring for your future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had a really cool conversation about plastics and reconstructive surgery at St. Luke's University Health Network, thanks to our knowledgeable panelists. All right, we've got some questions from the members of our audience. Are you guys ready?
Absolutely.
All right, Dr. Moline, this is for you. I had reconstructive surgery when I was younger, but my body has changed over the years. What are my options to help me feel more proportional and confident? Which is such a great question because you mentioned things can change. It doesn't always stick 30 years later.
And I think that's so important, even at the beginning conversation when someone's just starting their reconstructive journey, for a woman to know that her options can change over time gives them such a sense of relief. Also, maybe that they don't have to rush a very important decision or that their decision can change. And there's a huge spectrum of breast reconstruction ranging from what we call an aesthetic flat closure all the way to autologous reconstruction and in between implant-based reconstruction. By examining that patient, looking if it's just excess skin that might need to be addressed, maybe an implant size that needs to be changed, or maybe they would like to look at their autologous options. All of those things are a possibility, but really coming in, having an honest conversation, getting to know one another, and trusting that they're making the right decision for them at the right time.
Dr. Sanders, this question is for you. I'm scheduled to have a bilateral mastectomy for breast cancer. Can you tell me about the breast reconstruction process, including my options, and should I consider having it done right after my mastectomy? You hear this a lot. I'm in a certain age group of women in their 50s where you hear this happening, and it's complex. There are a lot of options, and people aren't sure when to do it. So what's your best advice?
There are a lot of options, and figuring out what the right option for the patient is the trick. And a lot of that depends on what the patient's goals are. A lot of that depends on physical exam. A lot of that depends on what, if any, post-mastectomy treatment or oncologic treatment if a patient might need. In terms of timing on when to do breast reconstruction, for most patients, having a reconstruction done at the time of the mastectomy, or at least starting the process, is a good option. Most breast reconstruction is done in stages, and the patient should be aware that no matter what she ultimately decides, it's going to be a little bit of a process that the plastic surgeon and the oncology team is going to guide them through. And that process, can change over time, and discussion with the surgeon in terms of what the best options are as she's going through the process and the healing process, because things change and things come up. And then during that process, she might decide, I don't want any type of reconstruction. And those are certainly options that can be discussed as well.
Certainly a complex time and a lot to be thinking about. Dr. Moline, this is for you. I recently had a baby and I am not planning to have any more children. I'm curious about the ways to get my pre-baby body back. Don't we all that have had children wonder this very thing?
Very true. I can connect with many of my patients about this. Well, first, congratulations on having a baby. It's a very exciting time. There are a multitude of things that can be done to get that pre-baby body back. I think it's important to talk about, we hear this term, mommy makeover. That can entail so many different things. You're looking to address your breasts, your abdomen, or other parts of your body that may have changed. And those are all options. But again, I think it's so important to make sure you're at a place that you're pretty happy with your body and you can maintain that body. Because the stronger you are going into surgery, the stronger you'll be afterwards. And you'll really be motivated to maintain those changes that you decided to make. That's a very empowering situation to be in as a woman, to know that you've made a conscious decision to make some changes to your body and to trust us to be a part of that journey, but also knowing that you're going to be able to maintain it. And that's really important. The other part, too, is making sure that you have help at home.
I was just going to say, make sure you don't have to pick up a needy 15-month-old every day.
And there are ways that we can arrange for you to have help if you don't have it already, but making sure that you know those post-operative expectations so that your family isn't going without you for a prolonged period of time.
Great advice. All right, we have time for one more question. Dr. Sanders, for you. I've lost about 100 pounds and I have a lot of excess skin that is just hanging there, especially under my belly and around my hips and thighs. I've heard about lower body lifts in those areas. Would this help and what is involved? I've never heard of this, a lower body lift.
Yeah, so a lower body lift is typically for patients who, like this one, have lost a significant amount of weight. And it's not uncommon to have patients come in who've lost 100 pounds or more. And again, they end up having oftentimes issues with rashes and infections and just, sometimes pain limiting their daily life in terms of their activity. So what a lower body lift is a surgery that removes the skin essentially from, below the belly button, around the hips, and oftentimes around the back as well, to get rid of a lot of that extra skin. It definitely helps improve shape and contour. It also will help eliminate some of those symptoms that a patient is having. Whether or not a patient would benefit from a true lower body lift versus something like we call a paniculectomy, which is mainly just addressing the front of the abdomen as opposed to around the sides and around the back. It's really a good conversation to have with the surgeon in terms of what their symptoms are, what their goals are. But these surgeries are, pretty extraordinary in terms of the results that patients get, which is immediate, which they see, dramatic difference even right off the operating room table, which is a pretty rewarding process.
As you both mentioned when we first started this program, you got into this field because you were so interested in how you could help people in the varied ways that happens. So thank you so much for sharing your expertise and letting people out there know there are a lot of resources available to them at St. Luke's. For more information on plastics and reconstructive surgery services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. Thank you for tuning into this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.